Good evening to you, Dr. Stephen. Appreciate your time. Now, less than 2% of all doses administered globally have been in Africa. Many people say the World Health Organization are failing the continent.
Thank you for having me. Good evening. So first of all, let's look at the statistics around vaccination on the continent. So far as today, we have received about 92 million doses. Almost close to 70 million has been administered, and about 25 million people have been fully vaccinated. This accounts for about 1.7% of the total population on the continent. So yes, we had challenges with vaccine deliveries in the last 3 months, but in July alone, we have seen increase in deliveries of vaccine. We received over 12 million doses on the continent, and the vaccine delivery is ramping up. We are also going to receive more vaccines, but this the inequity still remains across the world. By far, Africa is still lagging behind with regards to access to these vaccines.
Why would you say that is?
Yeah, the more wealthier countries are accessing this vaccine, leaving behind the countries in low and middle income, as well as, of course, we know the issue of the vaccine, the dosage sharing. We got some from the United States, but definitely that is not enough. But WHO continues to advocate for ensuring that vaccines are delivered to countries in Africa. If you hear the recent development on the issue of some countries like Israel approving a third booster dose, for instance, while countries in Africa are still struggling, a lot of people haven't got their first dose. This is expanding still the inequity. But of course, we continue to call on countries to share their doses and make sure that the most vulnerable are also vaccinated in Africa.
What kind of logistical issues are you facing on the ground? A lot of, the African countries have vast expanses geographically. I mean, it's obviously quite difficult to reach all those people. What kind of logistical issues are you facing at the moment?
Okay, so 2 issues. First of all, we talked about the issue of access, how much vaccines we have. In the last few months, we have some countries, even in Africa, exhausting the entire 100% of doses they received. With regards to logistics, first of all, some countries actually, it's about, like you said, geographical coverage and the vaccination sites, including the number of people administering the vaccine. But that is not the major problem why Africa is lagging behind. The major problem is the access to the vaccine.
That spells to me the word politics. I mean, a lot of countries, first world countries, are seemingly holding on to their doses for themselves. Where do we stand with those negotiations with COVAX and getting those distributions to the African countries? It sounds as like you're up against a brick wall. Would that be a fair assessment?
Yeah, there has been a lot of improvement with regards to the COVAX supply. They had a setback when India had the third wave, where they stopped supplying vaccines to countries in Africa. But like I said earlier, in July alone, we have received 12 million of the vaccine, and we are set to receive another almost 90 million doses between now and September. So the COVAX dose is improving. Then we have additional access to vaccines through the African Union, their agreement with the J&J. It has started coming into countries. And of course, a lot of countries have received bilateral donations from some of these wealthier countries. So it is gradually ramping up the issue of access to the vaccine on the continent.
I mean, it's difficult to believe that, considering the death toll at the moment on the African continent. Your Director General, your organization's Director General, Mr. Ghebreyesus, says that many African countries are prepared to roll out the vaccines, but the vaccines have not arrived. He's lambasted global power countries of an unjust distribution of those vaccines. What is the World Health Organization doing to try and fight this?
Okay, so let me address the issue of the death toll that you earlier indicated. So vaccine is not the only solution, just to emphasize this, to the COVID-19 response. In addition to vaccination, we have to make sure that we are testing, we are providing care to people, making sure we are isolating, contact tracing the general population, observing the public health and social measures. So these are important public health measures that need to be ramped up in addition to the vaccine. So what the vaccination does is that it reduces, of course, the severity of disease. Peradventure, somebody contracts the disease. If you're vaccinated, it reduces your chances of developing severe disease, of course, ending up in the hospitals and dying eventually. So it goes a long way in reducing that. But before we get to that, we also need to make sure that other aspects of the prevention and control are taken care of, like I said earlier. So with regards to the vaccination, we continue to advocate for more doses for countries in Africa, but we shouldn't forget the measures that we know already work, making sure that we are dictating these cases, isolating, testing, making sure that we are providing care to those that have cases. Prevention is always, always better. Avoiding mass gathering, wearing of face masks on a regular basis. Because, you know, with the Delta variant, the increase in transmissibility, increase the rate at which this virus is spread among the population that are unvaccinated. So we need to put everything together to make sure that we are responding properly.
Just quickly in closing, I've got 30 seconds for you. Can you assure our viewers tonight that the WHO are fighting hard for the African continent, for countries like South Africa, to get more vaccines onto the continent?
Yes, we are fighting hard for countries in Africa to receive vaccines, and we will continue to fight in Africa until we see the inequity reduced significantly.
Thank you very much. We appreciate your time, Dr. Mary Stevens from the World Health Organization, joining us here on Newsnight for an update on the COVID numbers across the African continent. Pretty startling numbers, a huge rise coming out of the African continent as well.